Good day, everyone. We are the Group 1 and we are here today to discuss on our case study about chronic obstructive pulmonary disease. So first off is we're going to start off with our introduction. Now, chronic obstructive pulmonary disease is a condition marked by persistent airflow limitation that is usually progressive and caused by an increased chronic inflammatory response in the airways and lung to noxious particles or gases. It is a group of conditions that cause breathing problems and airflow blockage. And chronic bronchitis and emphysema are two instances. Now, emphysema is a lung disease in which the little air sacs at the end of the lungs airways are damaged. Chronic bronchitis, on the other hand, causes airway inflammation that causes a persistent cough that generates phlegm. Now, because of its prevalence, COPD has become a prominent source of illness and mortality around the world. In fact, according to the WHO, it is now the third leading cause of death around the globe, which has caused over 3.23 million deaths in 2019, which is responsible for 6% of the total deaths in the world. Furthermore, it has identified that over 80% of these deaths happened in low and middle income countries. However, COPD prevalence, morbidity, and mortality vary across countries. Now, in the Philippine setting, COPD ranked as the seventh top cause of death. It has a 14% prevalence rate in Metro Manila and a 20% prevalence rate in rural areas. The global impact of this respiratory condition is projected to grow, imposing a significant economic cost on individuals and society. The natural history of COPD is punctuated by exacerbations which have major short and long-term implications on the patient and healthcare system. Evidence-based guidelines stipulate that early detection and prompt treatment of exacerbations are essential to ensure optimal outcomes and to reduce the burden of COPD. Several factors can identify populations at risk of exacerbations. Now, implementing prevention measures in patients at risk is a major goal in the management of COPD. Now, the goal of COPD management is to enhance the patient's functional status and quality of life by retaining optimal lung function, alleviating symptoms, and preventing exacerbations. Although no treatments have been found to significantly enhance lung function or reduce mortality apart from lung transplantation, oxygen therapy, and smoking cessation may reduce mortality. Now, it is critical to educate the patient about COPD and urge active engagement in therapy once the diagnosis of COPD has been made.